Welcome to our medical terminology review with regard to your eyes and your ears. So pay attention and listen up. What do you say to that? Okay, bad pun. I know. So let's start with the eyes. I find it very interesting if you look at the percentage of the whole body that the eyes, the optic system takes. It's rather small. It has a very small footprint, if you will, with regard to the entire body. Yet this is the most complex system in the entire body. And honestly, I can tell you mechanically how it works, but I don't know how cameras work either, so I don't know what that says. Much less television. Yikes. So let's take a look at the optic system. This is the entire system in a whole. Okay. And like I said, it is the most complex of all body systems. Now, it consists of the eyeball. You're probably all familiar with that. And then, of course, the optic nerve, which is there on the bottom right side of your screen, which sends the information taken in by the eye up to your brain. So your brain can say, oh, I know what that is. Okay. So, excuse me. All right. Sorry. Okay. So that goes right up into the brain. So the brain can say, okay, I know what that is, or maybe I don't know what that is, but start analyzing the pictures. Okay. The extraocular muscles, which are here on the outside, help the eye move, because that's important, because you can't be doing that all the time. Okay. Your cranial nerves, which I said attach to the optic nerve, which interpret what the eye sees. Of course, blood vessels. And you remember that from our cardiovascular discussion, how these blood vessels bring oxygen to the cells and help it stay alive, kind of like a cheeseburger or a Beyond Burger. If you're a vegan, that's your choice. Okay. Orbital adipose, adipose is the medical term for fat. And then the lacrimal system, which I'm sorry, but that's your tears. Okay. All right. All right. Yeah, I won't give up my day job for an acting job either. Okay. So let's take it all apart. So the sclera. Now, as you look at the picture, you see the sclera is the gray, the light gray that goes around the whole outside of the orbit of the eye. All right. And this is a protective layer of the eyeball. It's dense, it's white, it's fibrous. Excuse me. So this protects the eye in the eye socket. Anterior of the eyeball, the front, the sclera meets the cornea. Isn't this nice? And this is known as the limbus or the corneoscleral junction. And in medical terminology, we like corneoscleral junction much better than the limbus because we can take this apart. Cornea, sclera, scleral. Okay. So this is where the sclera meets the cornea. Okay. As the sclera comes around the back, which is to the right side of the picture, posteriorly, that means back, it meets the dural sheath, which is not identified on this picture. Also referred to as the lamina cribrosa of the optic nerve. So that is that gray, again, that gray part. Okay. Wow, who wants to be an ophthalmologist? No. Okay. Then we have the cornea. And if you know anybody who has had cataracts, you probably are familiar with the cornea. And as you look at the picture, it's the fourth word down, and it's basically that very front part of the eye. All right. It's curved, which gives you that dimension. It's multi-layered, as is everything in the body, and it's transparent. So that gives the light the opportunity to get through to the pupil and the lens. Okay. The cornea's only function is to refract light rays, and it's kept moist by tear film. Now, look at all of these different terms for the different layers of the cornea. And you know, I would think that something that only refracts light wouldn't have to be so complicated. But you know what? I wasn't invited to the meeting. Okay, so epithelium, that should be familiar to you, right? The epithelium, the top layer, and that's where your sensory nerves are. And that's what's going to cause you to say, ouch, if somebody pokes you in the eye. Bowman's membrane is the location of epithelial cells, like skin cells, right? The epithelial. Stroma, supporting tissue that makes up 90% of the cornea. Descemet's membrane is elastic fibers. Again, you want to have that movement because your eye moves over 100,000 times a day. You got to have that flexibility. And then the endothelium, and you remember, because that's what you're here to learn, but since day one, right? Epi means outside. Endo means inside. So you have that part. Okay. Again, you know, we go over this and you might be thinking, well, this is just like anatomy class. And it is in a way, and we've talked about this, is to just sit and look at an empty dictionary and say, okay, memorize all these words. I don't know that that helps you fully understand what the words mean or what they refer to. So we are connecting the words with their meaning. Okay, the uveal tract. This is the middle layer of the eye, just inferior to the sclera. So we have the sclera, then inside that is going to be the uveal tract. In the front, in the anterior, is the iris. You know, that's the colored part. Okay, that's your iris is blue or green or brown. All right, that surrounds the black, which is your pupil. And you know, your pupil is what opens and closes depending upon how light or dark the area is. If it opens all the way, excuse me, it will open all the way in a dark room or when you're outside where it's dark. But if you're in a well-lighted room or in the sunlight, your pupils should become like pinholes because that's protecting too much light from getting into the eye. Does that make sense? Good. Okay. So the aqueous humor is what? The aqueous humor is the root of the iris. And look at all these words. I know, right? It's like, okay, so you have the ciliary body reaches from the root of the iris to the ora serrate. This creates aqueous humor. The choroid, the most substantial portion of the uveal tract, contains blood vessels that are connected by the suprachoroid externally and by Bruch's membrane internally. Right, exactly. All right. But again, in this level of detail, what are you going to do? You're going to turn to your medical dictionary. Okay. If you go to work for an ophthalmologist, then great. You're going to need to know these words. If you become an ophthalmologist, you're going to need to know these words. Now I'm rubbing my eye, which is, you know, not supposed to, you're not supposed to do that, but okay. All right. The retina. And in the picture, the retina is that gold that goes around and also leads into the optic nerve. Okay, so you have the sclera on the outside, then the choroid, then the retina. Okay, look at all of these layers that are protecting your eye so it can do your job, right? Isn't it's amazing? So the retina is where the nerve endings are, responsible for receiving the visual images and sending those images to the brain for analysis, which is why, as you can see, the retina is attached there right into the optic nerve. All right. And if you don't know this, if you ever feel, if you're in an accident or something, and it feels like somebody threw black pepper in your face, you need to go to the emergency room right away, because that is an indication of a retinal detachment. Now, what's going to happen if it detaches from your eye? Nothing good. All right. The choroid is lightly attached to the retinal, right? Here we have right there. Okay. Adjacent to rods and cones, which permits you to see colors, rods and cones. Now, each of the different cones together provide color designation, and this is something that I find very consumer ironic, I guess. All right, so you see, the human eye can see up to 150 shades of color. Yet go into a Home Depot or a Lowe's or a Sherwin-Williams paint store, and what you're going to see is far more than 150 shades. So it just makes it more complicated. But actually, the truth is it's the same color, just different intensities. Okay. So one type of cone in your eye reacts to red light. One to blue violet, which you remember violet is red and blue together. Okay. And the third is green. So that gives you your red, blue, but green is actually the combination of blue and yellow, but there is no yellow here. But yet we have green. Okay, so then the eye just kind of mixes this up like they do in those big shakers at Home Depot, and voila, you can recognize the red dress from the rose dress from the magenta dress or shirt or pants or tie. Okay, all right. Now we have the lens of the eye, and this is probably what you think is the most familiar part of the eye, but look how far deep into the eye it is. Isn't that interesting? Okay. And the lens is what gives you your close or distant vision. So the lens goes through what's known as accommodation, and that's how physicians refer to it, as accommodation. And that's the lens's ability to see things close up, nearsighted, all the way up to farsighted. Okay. The lens is what moves and shapes in order, just like the lens of a camera where you have an f-stop and you control it this way. In this case, the lens goes this way. Okay. To look at something at a distance, like when you're driving, okay, the lens flattens out to see something far away, the lens gets bows, becomes has more of a curve to it. Okay. The vitreous humor or the vitreous chamber. This is the eyeball. This is the bulk of the eyeball, 65% of the eyeball, and it consists of 99% water. 1 tiny percent of insoluble protein. But this is why drinking water and keeping your body hydrated is important to your vision. And I'm not saying the water that you drink goes into your eye. That's not what I'm saying. But what I'm saying is that this, like several parts of your body, use that hydration in order to function properly. Okay? So this gives you the shape of the eyeball. But, you know, most of this you cannot see from the outside. You don't know what's going on back there. It just works. Isn't that amazing? All right. Any questions about the eyes or the optic system? I know that's a lot of really complicated medical terms. And again, I want you to review them. So if you need to know, if you need to go to the eye doctor, or if you need to know this, I want you to at least go, oh, that sounds familiar, and then go look it up in the medical dictionary. Okay. All right. So now let's talk about the ears, which is very interesting to companion this with the eyes, because as I told you, the optic system is the most complex body system, whereas the auditory system is incredibly simple. So let's take a look. You have 3 sections to the ear. The external ear, and thank you very much. Okay, we have the pinna, which is also known as the helix. Okay, so the pinna is actually at the top, and you see the term helix in the at the like the 11 o'clock position on your slide. Okay, that's this top part of your ear that gives you a part of the cupping. You know, if you've ever come across something where you can't hear very well, you might cup and add to that cupping that your external ear is already performing. And then you have all the way down to the earlobe. And I'm sure you're all familiar with your earlobe because you may or may not be pierced, have your ears pierced. I know there are a lot of things getting pierced, but the earlobe was the first, and it needs to get credit for being the first piercing place. Okay. And so that's at the bottom. And like I said, this gives you that conical opportunity to collect the sound and funnel it into your ear canal. Okay. The acoustic meatus, the external auditory canal. You know this part of your ear. This is where you are not supposed to put Q-tips, but I do it anyway. Okay. All right. And then at the juncture between the external ear and the middle ear, and you will see this, it's the second item. You see that kind of pink, again with a curve, okay? That's your tympanic membrane, commonly called the eardrum. But it's important for you to know tympanic membrane, because there are a lot of things that will use that root term tympanic, especially in diagnoses, well, and also procedures. Okay, so that eardrum is right there, you know, at the end where your Q-tip lands, but don't push it too hard, because then you're going to hurt your eardrum. Okay. All right, so the vibrations come through the canal and beat the drum. And then the vibrations are going to continue. And here, and you remember when we talked about the skeletal system, and I told you that your femur is the largest bone in the human body, and the three smallest bones in the human body are right here in the middle ear. You have the malleus, the incus, and the stapes. And look at the stapes. The stapes, I don't know if you're familiar with English horseback riding. Okay, that looks just like a stirrup that they wear to put their foot in at the bottom of the saddle as they're riding a horse. And that's why you'll also hear the stapes referred to as the stirrup. Okay, these three teeny tiny, remember I told you the story that if a person jumps off the Empire State Building and lands, they could break all 203 bones in their body, but most often the malleus, the incus, and the stapes will not be broken because it's so cushioned, because this is now inside of your head. Okay, so the sounds come through the tympanic membrane, which then, just like a drum, is pushing through the sound to the malleus, to the incus, and then to the stapes, which is then getting ready to go into the inner ear. Okay, so it's just like a relay race, passing along those vibrations. And then we get into the inner ear. And the inner ear has basically two parts to it. You have the hair cells, teeny tiny cilia, little teeny tiny hair that, again, like the wheat in a farm, I don't know, I grew up in Brooklyn, but okay, you know, moves as the wind goes through it. It converts those nerve impulses. I'm sorry, the hair then converts into nerve impulses that are sent through the vestibular branch into the acoustic nerve, which is the 8th cranial nerve, to the brain to say, oh, that's my daughter's voice. Or, oh, that's my husband's voice. Your brain does that. But if it wasn't for the help of the inner ear, your brain wouldn't know. Okay. In addition, you have the vestibular nerve and the cochlear nerve and the semicircular canals. And these fill up with fluid and aid in balance, in your ability to actually walk without falling over, which I find to be a pretty good thing. Okay, so what happens if there's an infection or too much fluid? That can cause vertigo. And that's happening in your inner ear as well. That's a lot of work, but look how simply, maybe the eyes ought to take note from the ear and how to simplify the processing of something. But processing sound, I think, is much less complex than processing pictures. No matter what do we have? We have a whole bunch of very complex, very medical terminology type words, right? So what are you going to do? I tell you this every week. You got to do it. You got to review these terms so you become familiar. You got to use your medical dictionary to make sure that you are remembering the correct definition of the word and not what you kind of sort of think you remember. And then query when necessary. And who you going to ask? Me. I love it when my students ask questions, and I want you to really get your sense of this language, because no matter where your career takes you through the healthcare system, You need to understand the language. Okay? All right. Any questions? All right. You guys are wonderful. And remember, I'm here for you 7 days a week. So please have a wonderful day and a wonderful weekend. Okay? Bye.